Marcia Amarsingh, Marcia Amarsingh holds a master's degree in counseling and is currently pursuing her PhD in psychology with a specialization in addictions. She is an independently licensed drug and alcohol counselor in Massachusetts, Rhode Island, and Connecticut. She is the executive director of Amarsingh Integrative Counseling Services, a private practice, president owner of Renewal Sober Living, president and owner of Upliftment Wellness Center, both sober houses, and she's also executive director and owner of Renewal Integrative Psychotherapies, LLC, which is a mental health and substance abuse clinic. She has worked in many capacities, including as a direct care staff member at a residential program for the treatment of juvenile males with drug addiction and for detoxification. She has also worked in community-based counseling, in-home behavioral therapy, and correctional health services, and she has managed a structured outpatient addiction program. Ms. Amarsingh was the regional director of behavioral health services for nursing homes and the clinical director of a co-occurring enhanced residential program. Ms. Amarsingh was recently profiled in Worcester Magazine's Women's History Month feature as one of the movers and shakers in Worcester. An official welcome to Marcia as she talks to us about mental health and addiction.
Thank you so much, Peter.
You are welcome.
Let me get started. I would like to go ahead and share my screen. Am I there? Can you see it?
Yes, I'm seeing it.
Right. So today I'm going to discuss a little bit on addiction and mental health. Now, I know many people talk about mental health a lot. It's a mental health month, but I think one of the major mental health disorders that we experience in this country today is addiction. And I don't think that we've been talking too much about it. So I'm going to do a little bit of education and we'll go into a little bit of the drugs that's out there for you guys, and then we'll open up for discussion. But in the meantime, you can still stop me along the way if you have any questions, so we can, have that discussion going. Because sometimes it's hard to recap the question you have at the end of the presentation. So, what is addiction? Addiction is derived from the Latin term meaning enslaved or bound to. And I know many of us say, oh, the person caused this addiction, the person did it to themselves. And so I want to differentiate that. Initially, the decision to pick up a drug or a behavior, addictive behavior, is on that person. But once it gets to the stage of dependence, then it no longer is, your decision. The decision has been made for you, and then you are almost enslaved and bound to that particular chemical or behavior. Now, addiction has gone through numerous definitions over the years, but in 2000, it was redefined as addiction is the primary chronic disease of brain reward, motivation, memory, and related circuitry. And dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. So this affects the entire person. This is reflected in an individual pathologically pursuing reward and or relief by substance or other behaviors. Addiction is also characterized by the inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of any problems that this behavior or substance use might cause in their relationships, work, legal stuff, in all aspects of their life. Like any other chronic disease, addiction often involves cycles of relapse and remission. So one moment this person is doing very well, is in recovery, sober, and the next minute this person is relapsed and doing really, really badly. Without treatment or engagement in recovery activities, addiction is progressive and results in disability and death. So we call it a chronic progressive brain disease. So let's look at the ABCDs of addiction. So the inability to consistently abstain, that's one. Impairment in behavioral control. There's cravings all the time. The person hunger for the drug or the behavior. And the cravings are so intense that it's really, really, really hard for them to resist that in the moment. Cravings typically last 15 minutes. And so I tell my clients that all the time. In that 15 minutes, when you have that intense craving, if you're able to distract yourself, to do something else, then that will go, that will pass. But it's that intense that it's so hard to resist that if they're not highly motivated, that's the moment that they will pick up or start to go down the drain with the relapse process. Diminished recognition of significant problems with one's behavior and interpersonal relationships, and a dysfunctional emotional response. Now, let's look at the brain a little bit. So, in that middle part of the brain where you see the corpus callosum, that's where most of the activities of addiction takes place, particularly in the nucleus accumbens. And in this area, this is the entertainment part of the brain, the happy part of the brain. This is kind of, if you're thinking about New York, this is the Manhattan of the brain. Everything goes on here that's happy and euphoric. And there are particular neurotransmitters that are produced in the brain. So this is what it looks like here, where there's a reward center, the memory is right there, pain is right here. It's all intertwined right here. And the neurotransmitter that is particularly important in this area is called dopamine. So, dopamine is that chemical that makes you feel euphoric, happy, glad, excited. And when dopamine is produced, right, you feel contented. Now, most people who suffer from addiction suffer from a mental illness, whether it's anxiety, mostly anxiety, and also depression. So, if they are suffering from depression, it simply means their brain is not producing enough of the chemical dopamine. They're not able to feel good. They're not able to feel happy. They're not able to feel contented. And so, when they use these drugs or certain behaviors, it mimics the production of dopamine. Right? So, I explained this part. So, all right. So it mimics the production of dopamine and they feel happy. So, say, for example, someone has been suffering from depression for a long time and they suffer from a particular disorder called anhedonia. Anhedonia is the inability to experience anything pleasurable. And then somebody says, here's a whiff of some cocaine. And that person sniffs the cocaine. That cocaine acts just like dopamine in the brain, and then they feel this great sense of euphoria, this happiness. And it's different. It's a really good feeling. They've been longing for this feeling. And so now they will start using, right? They'll start using each time they want that feeling, they'll try to use it again and again and again. And so this is actually predictable. They know they will feel better when they use it. And many people use it starting as self medication and not even realizing that they're self medicating. And then it becomes I need this to survive. I need this to even function. So, how these neurons, these dopamine and adrenaline and epinephrine and serotonin, we have so many different types of neurotransmitters in our brain for different functions. But today we're focusing on dopamine. And so, how these neuron works, they communicate with each other. So neurons convey information by transmitting messages to other neurons or to other cells or muscles in the body, and then communication is a chemical process. So this is kind of what the activity looks like in that part of the brain. You know, when you have these triggering stuff, the message is sent, this person feels excited immediately, and everything is okay, everything is normal, right? And I did mention some of the neurotransmitters that we have in the brain, and dopamine is the one we're talking. So, over time, by using these drugs or behaviors, right? And let me stop for a little bit because I've been talking about behaviors. So, there are a number of behaviors that becomes highly addictive. One, gambling, right? Two, um, uh, internet, social media is a big one right now. Um, we have anger is classified now as an addiction. Sugar can be an addiction as well, right? And sex can be an addiction. Shopping can be an addiction. So there are many behavioral addictions. And then when it comes to drug addictions, we have different chemicals. So we have um, marijuana, which we know that's a highly addictive, although many persons will argue about that. We have the stimulants, which includes crack and cocaine and methamphetamine, crystal meth. You know, we have the opioids, which includes prescription opioids that are, are usually given by the doctors for pain. But we have heroin, we have carfentanil, we have xylazine, we have flakka, we have so many of those. We have Black Death, we have all those coming out right now. That's just killing off all our people. And when it comes to like hallucinogenics, we know we have mushrooms, we have LSD, we have peyote, we have Molly, MDMA, all that. And then we have also other drugs like K2, which is synthetic. So we have synthetic marijuana, which is K2. And then, of course, we have our general ones, nicotine, caffeine, and alcohol use disorder, right? So there are so many different types of drugs that causes addiction right now. So what happens is whether the behavior or the drug, over time, by using and abusing, the drug stops producing dopamine in its entirety. And so now, in order to even feel okay, to sometimes even get out of bed, that person has to use the drug or, go towards the behavior. And so at this time, the brain becomes hijacked. We call it the hijacked brain. So addictive drugs provide a shortcut to the brain's reward system by flooding the nucleus accumbens with dopamine. The hippocampus lays down memories of this rapid sense of satisfaction, and the amygdala, which is the emotional part of our brain, creates a conditioned response to certain stimuli, and this equals addiction. So, dopamine then interacts with another neurotransmitter called glutamate that takes over the brain system of reward related learning. This system has an important role in sustaining life because it links activities needed for human survival, such as eating and sex, with pleasure and reward. The reward circuit in the brain includes areas involved in motivation and memory as well as pleasure. Addictive substances and behaviors stimulates those same circuits and overload it. Hence, addiction now becomes more important than survival mechanism as eating and sex. That's how crucial addiction is. It takes over the brain completely. The person has changed. This individual is sick. This is not a normal person anymore. This person will never be normal again. We cannot have normal expectation of this individual. It's just not practical anymore. So, repeated exposure to this addictive substance or behavior causes nerve cells in the nucleus accumbens and the prefrontal cortex to communicate in a way that couples liking something with wanting it, and in turn driving the person to go after it. So, all that person can think of every day, all day, is getting that drug or the behavior. So whereas we're multitasking, we have a number of things on our Saturday list that we're gonna be checking off, and you could probably be making your supermarket list right now while we're talking. An addictive person will not do that. They don't multitask well. They can only focus. They're preoccupied all the time, every day, with how they're going to get their drugs, what's going to happen, whether they're going to have to steal, prostitute, whatever way, con, manipulate, whatever way they're gonna have to get it. That's the thinking that's going on in their brain. So when someone it becomes addicted, when the brain becomes dependent, there are two things. Well, there's three, but we're talking tolerance and compulsion. So over time, the brain adapts in a way that actually makes the sought after substance or activity less pleasurable, which means the brain has developed tolerance to the drug. And you need more and more and more to get that same amount or the same pleasure. And as a result of these adaptations of the brain, dopamine has less impact on the brain's reward center. People who develop addiction typically find that in time, the desired substance no longer gives them so much pleasure. They have to take more to obtain dopamine. And then compulsion takes over. The pleasure associated with the addictive drug or the behavior subsides, and yet the memory of the desired effect and the need to recreate it persists. So it's the memory of the happy times that they had that keeps them driving to get more and more and more. That memory is so prominent that that's all they can think about, and we call them the glory days. Oftentimes we might see someone with an addiction just sitting and dazing, just sitting and kind of looking out into space. That's what's going on when if they want to tell you, they're really thinking about these memories, the memorable moments they had and those glory days, and just yearning for that one more one more time. Now, the hippocampus and the amygdala store information about environmental cues associated with the desired substance. And these memories help to create a conditioned response, which gives an intense craving. So with the memory, anything that reminds them of the drug use, whether it's a scent, whether it's a spot, whether it's a person, whether it's a thing, any reminder of the drug presents with intense cravings, right? So immediately they're triggered. We call it triggered to use. Now, will everyone who use drugs become addicted? No, right? So we have certain factors that play into addiction. The biggest one is genes, the genetic factors. So 65% of people who will become dependent on drugs or alcohol or behaviors has a genetic predisposition. And then maybe another 10 would be, environmental cues and so on, right? But genetic factors play a major, major role in someone developing addiction. Culture also plays a role in addiction, because there are certain cultures that promote certain substances, right? So if you are in Jamaica and you are part of the Rastafarian culture, then you're expected to have marijuana as a religious right. If you are Irish, you know, um, then you're expected to be drinker, right? It's common for Irish to drink. They say, "Oh, I'm Irish, I drink," you know. And different cultures promote different drugs and so on and so forth that leads to and different behaviors that leads to addiction. Other factors could be biopsychosocial spiritual manifestations, like the presence of underlying biological deficit in certain circuits. So like if your brain is not working, optimal from the get-go, that's something. And that could be because of birth defects or environmental issues. We know lead in the environment and radon, and those things contribute to changes in the brain um, makeup of the babies of the child. So we know that those things could contribute as well to addiction. A child born as an addict is already an addict, and so the babies who are born in the NICU, and if you see them sometimes, they scream and cry because they have to be weaned and detoxified of these drugs when they're born. And so their brain, the memory in their brain will store that and they will remember it. And so if they ever try to use it for whatever reason again, off and running, they are full blown addict already. All right. And so then hence the more addictive babies we have is the more addicts we will have. Cognitive and affective distortions can impair perceptions too and lead persons to drugs and alcohol. Disruption of healthy support systems and problems with interpersonal relationships can lead people to go drink or use. Exposure to trauma or stressors that overwhelm people's coping abilities can lead them to go and use for, stress relief and medication management. Distortion in meaning, purpose, and values, attitudes, thinking, and behavior, all those things could lead someone to go starting to use. Um, any other psychiatric disorders like depression, bipolar, um, anxiety, you know, PTSD is a big one for the people like the soldiers who go to the military and they, come back and they've experienced all this trauma. They will want to know. A lot of them can't sleep at night. They have somatic issues and they will want to go use to go to bed to sleep. Yeah. Now, I said earlier that the addictive person is now a changed individual. That person is no longer the person you knew prior to the addiction. There is significant impairment in executive functioning. So the front brain that makes decision is no longer working properly. In fact, there are studies going on now in addictions where they're looking at the how they describe it is like there is a particular switch in the executive part of the brain that can switch on and off. And so, for example, if we're eating ice cream, it switches on and then it tells us you've had enough and it switches off. And so we know when to stop. They're discovering that that part of the brain for the person who becomes addicted doesn't stop. So it can't switch off. The switch doesn't work. So the person will drink and drink and drink until they can't drink anymore. They pass out. They won't stop. They will have to be stopped. Same thing with the person who is on heroin. They'll use and use and use and use until they overdose. Their body give out. So there's that part of the frontal lobe that no longer works, and that's kind of the switch that makes people know when to do things and not overdo things, um, which is really sad. Now, what are some signs of addiction? So there are cognitive changes. This person is preoccupied with substance abuse and substance use, altered evaluations of the relative benefits and detriments associated with drugs, the inaccurate belief that problems experienced in one lives are attributable to other causes but not the use of drugs. And they'll tell you that that's not the reason why I got in trouble. I got in trouble because of this. I got a DUI not because I was drinking, but because the police was a jerk. You stopped me. There's emotional changes as well. So there's increased anxiety, dysphoria, and emotional pain, increased sensitivity to stresses. So everything seems overwhelming at this point. Everything is a major crisis for this particular individual. Difficulty in identifying feelings, and distinguishing between feelings and body sensations, or that. There's also behavioral changes. So Excessive use or engagement in addictive behaviors at higher frequency. So you're seeing this person kind of different, moving differently, looking differently. Activities are now extremely different. They're moving toward just getting this drug. They're absent, they're avoidant, maybe not even giving eye contact at this point because they are so guilty of what's going on. Excessive time lost in substance use or recovering from the effects of substance use. So you might see them sleeping more because they're hangovers, or um depending on the drug, they're wired more. If they're on stimulants, they're all over the place. You might see like, wow, this person is acting really really weird, right? um you might see continued use. So you're finding, all kinds of drug paraphernalia now. You might see drugs in their vehicle, drugs in their homes, in their bedrooms, stuff like that. You might even see drugs on their body. You might start seeing, you know, um, like marks. If they're using needles, you will see, side marks on their arms, their feet, their eyes, their all the parts that they're now on their necks where they're sticking themselves. You might start seeing burns on their clothes or burns on their body, depending on what drug they're using. You're looking for physical signs. You might see their eyes bloodshot red, or you might see a pinpoint pupil, or, expanded pupil, depending on the drug. So there are just many telltale behavioral signs that you can look at. You can smell the drugs, some of the drugs that they're using. You're able to smell and do that. And so, what are some treatments of addiction? First, there has to be detoxification, which is just ridding the body completely of drugs, clearing the body. It's super important for persons who use alcohol or benzodiazepines that they have to like go to a medical facility to get detox, because a person who is trying to get off addiction from alcohol can die. It's very easy for them to. And so, I don't know if you remember during COVID, when we had that shutdown, that the only places that were allowed to stay open were bars and liquor stores. Do you remember that? And that was for a particular reason. We would have more deaths, people would be dying more. Although I think COVID caused more addiction. People were locked in, people were scared, they were bored. And so many people turned to alcohol and drugs. In fact, in the nursing homes, because I do go to a few nursing homes still, and in the nursing homes, the population has completely changed. And I was shocked. I saw like about 30 people last week in a nursing home. And of the 30, I'm going to say 20 or so were in their 50s, which is sad. Okay. So the other step is behavioral counseling, whether we're going to do intensive outpatient or outpatient, and then medication. There's so many medications for alcohol and drug use now. There's one called naltrexone that completely gets rid of cravings for alcohol and opioids, and they have an injection called Vivitrol that once you take that shot, you don't have cravings for 30 days. It's an opioid and alcohol blocker, so you can't take any pain medications while you're on it either. But it really helps with that. There are methadone, Suboxone, Sublocade, there's Camprol, there's Antabuse, and recently they discovered a drug that's really, really effective with cocaine use called baclofen. Baclofen, for those in the medical profession, well, that was initially used for like muscle spasm or something like that. And now they have discovered that baclofen is really, really highly effective with cocaine use. They can get evaluation and treatment for recurring mental health. And, most, like I said, 65% of people who develop addiction had a predisposition and had another mental illness, such as depression and anxiety. So it's really important that they get treated for depression and anxiety. And so it's important that they, go see a psychiatrist for medication management, so on and so forth, and other coping strategies. and then long-term follow-up for to prevent a relapse. Family support is super important. Um, addiction is a family disease, and people often regrettably do not know where to start. Repairing damaged relationships. They've stolen, they've cheated, they've manipulated, they've abused. It's really hard. So, family involvement is super important in treatment. And normally, the addicts will not heal without that. I can tell you from my experience working with the addictive families. And so, here's my contact information. If you need to reach me, if you need to ask me for any advice, any questions, that's just one of my businesses. I'm in the field of addiction in general, and my goal is to continue with the continuum of care for um, all addicts. And so I'm in the process of opening a domestic violence residential facility for women who are trying to um, leave their abusive homes. So that's my next project. And with that, I'm going to stop sharing and um, and ask you guys if you have any questions.